World Vision Southern Africa has just concluded its second Advocacy Learning Lab in Zambia. This is the second Citizen Voice and Action CVA Learning Lab in Zambia. It is designed to equip participants with knowledge and practical skills and capacity to facilitate and implement the Citizen Voice and Action approach within communities. At the same time, it also recognizes the broader citizenship and governance country situations. World Vision Zambia is the first country in Southern Africa to pilot CVA, with World Vision Uganda, World Vision India, and World Vision Kenya as being the others.
And specifically for this CVA, we've been privileged to interact with the communities and to really be able to see what's really on the ground when it comes to issues of health, and education. And what this CVA has done for Zambia is something that a lot of other countries, I think, need to emulate, especially when it comes to, creating that platform where citizens are able to engage, with their service providers. And in this case, we're talking about, the government that provides the services of health and education. So what is emerging for me in this lab is that there's been great and trust and collaboration that has come out from, the citizens and the people of the ADPs where Zambia is working. And secondly, I think it's quite evident that if you give people information on their entitlements, if you empower them to speak on their own, really, there would not be need for World Vision to be here, because we'd have already given the community that voice that they require.
Both the community members and participants monitored education and health standards against what the Zambian government policy stipulates. What were the results?
It was discovered that in the policy documents, government has provided that there should be 2 pupils on one desk. But looking at the situation, the actual situation on the ground, it was discovered that 6 pupils share one desk. Looking at that scenario, you can agree with me that the standard of service provision in terms of education is far below the standard and leaves much to be desired. So community members, together with government officials, came up with ideas and proposals on how they can improve the service delivery.
Citizen Voice and Action has empowered community members in Zambia even to question some decisions made by some service providers. For instance, at the clinic where women were asked to bring gloves and jik when mothers are due for delivery. To them, government should simply provide for such services.
Get me, all of you, get me. Me, I'm a TBA. So sometimes munzira, just my gloves. She have wearing my gloves. So that give me those gloves, then I can wear you.
The standard would not limit us to not getting involved in dialogue with the service providers and the power holders. Because if the situation, even if it is under standard, is not conducive or not favorable, it is bound to be changed. CVA is about changing practices, attitudes, certain policies, even the law.
The Zambian government clinical care officer, Mr. Monolo Shankanga, immediately gave this solution even before the interface.
Maybe individuals who, maybe at one time, they were told to buy jig, to bring gloves. As far as we are concerned, we allocate money to the facility. And that's why even now we are speaking to the community that no one should carry jig, not even gloves, to the health center, because they're already in the kit. The health center kit has gloves. Jiki, each center is allocated $1 million plus every month. They get that money. So we don't see the reason why such a practice should go ahead.
That's exactly one example of how Citizen Voice and Action CVA is helping communities in Zambia to demand for their entitlements. Even children made their own observations.
At that school, we found that in Lesho, we found that there must be 45 pupils in one class with one teacher, but we are finding that there are 105 like so with one teacher. It's very difficult to learn like that, and shortage of textbooks.
But have the participants learnt anything from this exercise?
The project has got elements that are supposed to be followed, which is the voice. After the voice, the information, then dialogue, and then accountability. At the end of it all, we want to ensure that the community members will be able to have relevant information about a performance of which they are going to voice out. When they voice out, there is going to be dialogue between the service users and the service providers. At the end of it all, there will be accountability in place.
Government is there for us, and because of us. We are the communities are the ones that elect people into offices of authority. And so when we go into those offices, we shouldn't be viewed as a nuisance or as these people are just coming here to bother us. But when we go there, we should be attended to as partners in development.
On the last day of the meeting, the head of the World Vision Advocacy in Zambia, Dr. Gertrude Chanda, presented the way forward.
The government is very, very satisfied with what CVA is going on, and also the understanding that CVA is not about violence, but rather dialogue with government, building a relationship with government, and also citizens being able to take responsibility for their actions or inaction, and not seeing the government as, an enemy, but rather that is an agency that is giving us services, and therefore there should be, discourse, dialogue, and relationship